You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
Pfizer secretly added heart attack drug to children's COVID vaccines, but why? This is by Ethan Huff out of Natural News. Now, it links back to an article from the Expose UK. Why has Pfizer changed the formulation of its COVID vaccine for children to include ingredient that stabilizes people suffering a heart attack? And then if you scroll down into this article, so you got to do a little work, it goes to an FDA briefing document. Here it is right here. EUA amendment request for Pfizer-BioNTech COVID-19 vaccine for use in children 5 through 11 years old, dated October 26, 2021. So just before Halloween, they decided to sneak this through. Now, if you go down to page 14.
And this is the incredible part.
Yeah, this is it right here. So it talks about the vaccine and formulation. To provide a vaccine with improved stability profile, the Pfizer-BioNTech COVID-19 vaccine uses in children's 5 to 11, uses tromethamine buffer instead of phosphate buffered saline as used in previous formulation, and excludes sodium chloride and potassium chloride. So there it is.
But that's not a buffer.
It's not a buffer. It's a literal heart attack drug, and that's what they claim here. So you go to drugs.com.
So again, they're doing all this through changing definitions.
They're just exactly how they change the definition of what a vaccine is. But here it is. Tromethamine is used to prevent acid problems in the blood. That doesn't sound like a buffer. That doesn't sound like saline solution when you think of saline solution. Now you go through, it says, well, it's not for newborns. That's one thing it says, but this is interesting. Some people may have very bad and sometimes deadly side effects when taking a drug. So there it is right there. And then it lists the different side effects that can happen. But this is what caught my eye more than anything. Medicine may cause tissue damage if drug links from the vein. Now, why is that interesting? So and this is from my understanding of when nurses give these shots, they're supposed to give them into the muscle, not into the vein, because if it gets in the vein, that's why you're having problems with these blood clots and other heart problems and other blood disorders that people are going through. So, and this says here, there's a problem if it leaks from the vein. It's supposed to be given intravenously, which would be
so they're mixing drugs that are contraindicated.
Exactly. And you can look at what the side effects are here. Allergic reaction, rash, hive, blistered, peeling skin, trouble breathing, hoarseness, swelling, low blood sugar, shortness of breath, fever. But then there's another little, you can go to more detail. Oh, and it has other ones, cardiovascular, chemical phlebitis, venospasms, cardiovascular. They say they're not frequently reported, but here they are. Excavation, tissue damage.
And again, Rob, I want to continue with this, but here's the big issue. They're putting another drug with another drug and then burying it in a document.
And nobody's talking about it.
Yeah.
That's the big thing. Nobody's talking about this. It's not, you have to go search through the 14.
But it shows they blew up, like Fauci said in 2019, we're going to blow the whole system up, do whatever we want.
That's true.
It's just mad scientists doing whatever they want.
And all they have to do is get a pandemic together, and then that gives them the excuse to do whatever they want and just change the rules.
And now they're putting very dangerous blood thinner in children.
Hepatocellular necrosis. That's the tissue damage that you're going to see happen when they give this vaccine to the kids right into their muscle, if they're giving it to them in their muscle. Now that
And again, this comes out right at the end of October. Here we are 10, 11 days later, and almost no coverage of this. Even Alex Jones didn't know about it, showing how incredible the censorship level is.